Hi, good morning, Lewis. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 26th of August 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Lewis Greenpath.
And what is your candidate number, please?
My candidate number is 245631212.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
All right. Can I see your ID, please?
Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Why did you choose nursing as a career?
I have always wanted a career that offers long-term employment and financial stability, and the opportunity to give back to others, without limiting my ability to care for my family. I feel like nursing can give me the best of both.
Is there a person or situation that influenced your decision to become a nurse?
For as long as I can remember, I knew I wanted to have a career in healthcare, and always leaned toward nursing. Several years ago, my grandfather passed away, and the nurses who cared for them made such an impression on my family and me that it kind of sealed the deal for me. I realized I wanted to impact others and encourage and lift them up the way those nurses did for my family.
Tell me some responsibilities you believe are part of the nurse's role.
I think the nurse's role is certainly multidimensional. Aside from performing assessments and giving medications and treatments, I believe nurses play an essential role in promoting good relationships between patients and their healthcare teams. I also feel that, if we use the right platforms, nurses can be instrumental in initiating and supporting measures to promote the profession for the good of patients, nurses, and all healthcare professionals.
Can you give me an example of how you would demonstrate accountability if you made a mistake in the clinical setting?
I think one of my biggest nightmares is to make a mistake in clinical and have to face the consequences. Still, I know things happen sometimes, and the most important thing is for me to be honest. If I made a mistake, I would immediately go to my nursing instructor or assigned preceptor to report the incident. I would not discuss it with classmates, as I know this could cause trouble and may compromise my patient's right to privacy.
What are some things you think are challenging about nursing?
I can only imagine some of the challenging things nurses face. One thing I think may be most challenging is handling situations when patients do not want to pursue life-saving efforts, but their families disagree. I also feel, if we are not careful to learn about and practice cultural competence, significant challenges could arise due to the cultural diversity within healthcare facilities and among patient populations.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking role play. Don't worry if I stop you when the time is up.
Good morning. My name is Louis Grantpath, and I am one of the nurses working in this community health center. How may I help you today?
Good morning, Louis. I have had a urinary catheter following an accident. Now, I think the urine is flowing around the catheter. I need to get it fixed.
All right, for documentation, may I know your name and age, please?
My name is Mihiraa, and I am 38 years old.
Thank you, Mihiraa. For my better understanding, can you please brief me regarding the catheter?
Sure. I had an accident 2 weeks back, which resulted in nerve damage. Due to this, I have had an indwelling catheter inserted. Yesterday onwards, I started experiencing urine leakage around the tubing. I need a better assessment and need to get it fixed.
Thank you for your information, Mihiraa. Apart from this, are you experiencing any other problems?
No, nurse. Currently, I am not experiencing any other problems. I'm good.
That's good to hear, Mihiraa. However, for confirmation, do you have pain over the catheter?
Not at the moment.
Do you feel a bladder spasm?
No, I didn't experience it yet.
Are there any signs of blood or minerals in the urine?
I haven't noticed any so far.
Do you have a fever?
No, I don't. I am okay.
Thank you, Mihiraa, for answering my questions. I will explain some of the causes of urine leakage in your condition.
Okay, nurse.
Most possible causes of leakage may be related to an infection. Since the catheter is inserted newly, there exists a chance of infection.
Oh, I see.
Another major cause can be the result of blockage, due to the buildup of blood, salt, or minerals in the catheter.
Okay. And what can be done in this stage?
Your question is reasonable. I will explain the next steps to be taken in your current situation. In your case, the catheter needs to be replaced, due to the possibility of causes we have discussed now.
Okay.
Mihiraa, for your better understanding, I will now outline the process of replacing the catheter. Initially, we will be removing the current catheter, which will be replaced with a new one. Afterwards, urine samples will be collected for testing. Then, the collected urine sample will be sent to the lab for analysis.
I understand the procedure. But you know, nurse, I am worried about the pain while doing the catheter reinsertion.
Your concern is quite natural, Mihiraa. Perhaps, there will be no pain experienced during the procedure. I will explain the procedure for more clarity. For reinsertion of the catheter, we will use the lubricant anesthetic gel, so that it will create numbness, and thus, no pain will be felt. Moreover, we will insert the catheter carefully, and the insertion will be slow as well.
All right. Now I feel much relieved.
That's great to hear, Mihiraa. I wish to inform you about the care of the catheter, in order to avoid such incidents in the future.
That will be of great help, nurse.
All right. Mihiraa, the first and foremost thing is cleanliness. Always keep the catheter clean. Another important thing is how you maintain the tube. It is important to avoid twisting or bending the tube so as to avoid damaging it. Finally, ensure the catheter is properly secured.
All right. I will do as you suggest.
I am glad to hear that. Now, I would like to make some recommendations to prevent catheter blockages.
Okay.
First of all, stay well hydrated. Drink an adequate quantity of water and ensure sufficient hydration. I also suggest you take more fiber-rich foods and avoid constipation.
All right, nurse. I will take care of it.
That's good, Mihiraa. Well, can I have your consent to have the catheter changed?
Sure, you may please proceed.
Thank you for your consent, Mihiraa.
Thank you. That is the end of your OET-speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.